the campaign, Protect, Invest Together, that was launched for the International Year of Health and Care Workers, and to brainstorm with you on how you as individuals, you as constituencies, or you even as the Youth Hub can support WHO to achieve the campaign's objectives. The designation of the International Year of Health and Care Workers was in response to a decision that was adopted by the World Health Assembly in November 2020. So a couple of months ago. And the decision requested the Director General that WHO engages at all levels with member states and with other actors in making the best use of the International Year to advance progress on SDG 3. And therefore, that's why this is one of the reasons why we see such engagement very important to us. Next slide, please. Next slide. Yeah, thank you. Before we start, just a couple of points on what we mean by the health and care workers. We've received a lot of questions around this, and we thought that at the beginning it would be very important to just give an overview of what is the definition that we're using. Now, in 2006, the World Health Report defined health workers as people primarily engaged in actions with the primary intent of enhancing health. And in 2017, the ILO, the Working for Health 5-Year Action Plan, which is the ILO, OECD, WHO, and it's an action plan for the health, for the Commission, for the work and the recommendations of the Commission on Health, Employment and Economic Growth, that was adopted in 2017. And it sought out all occupations that contribute towards improved health and well-being in the health and health-related social care sectors, and collectively refer to all of those as the health and social workforce engaged in healthcare. And this is, of course, recognizing that there are other activities within the health sector that are not health related. For example, you have marriage counselors as an example. So the definitions that we use in WHO are, we use two ILO standards of classification. One of them is the International Standard of Classification by Occupations, which is the ISCO 2008. And the other one is the International Industrial Classification of All Economic Activities, the ISIC 2008. And this classification really allows us to extract the social work activities that are relevant to healthcare based on employment. So it looks at the social sector, it looks at the health sector, and it defines those who are employed individuals. And according to this, for us, those who work in the social sector in activities relevant to health are those who work, for example, in residential care, providing personal care services for the elderly, for those who are physically challenged, providing assistance in daily living, but also in some instances, you have those providing nursing care services for the elderly. And also it includes social work without accommodation, counseling, and others. Those in their entirety, we're talking about 135 million workers, according to ILO 2019. And finally, we need to recognize that there are close to 57 million unpaid voluntary workers, the majority of whom are women, and those are providing a lot of informal care for family members. So why health and care workers? Because simply, we're talking about the health and social care sector workers, but simply because we're trying to harmonize a language across the different WHO regions, and our European region have used this language before us, the care workforce, and therefore we don't want to complicate things, and it's less of a mouthful, so it's easier for translation and other purposes. Next slide, please. So the pandemic, as you know, and we'll hear from our colleague today as well, has had and is having a significant impact on our health and care workers. And you've probably seen a lot in the news. You've probably read a lot in newspapers, but there are different sources that are showing the gravity of the situation and the burden on health and care workers. In WHO data from the WHO Global Surveillance System reported around 1.87 million health worker infections. And those are coming, there are reports coming to WHO, but they are coming mainly from the Americas and the European region. So this by itself tells you that there is information still that is not being reported. We are currently working on getting the full picture, and we are working on better measurement on health worker infections and deaths. We estimate the infections to be around 4 million health worker infections. These are based on our estimates. And we are also working on triangulating data from multiple sources so that we can produce these global estimates more formally on infections and deaths. Also, you may have looked and seen in many articles, one of them is the systematic review and meta-analysis that came out that shows the prevalence of depression around 23%, depression and anxiety, insomnia around 39%. During COVID-19, there has been also a lot of reports on strikes. 84 countries reported at the beginning of COVID-19 strikes because of indecent work, 38%, or because of lack of personal protective equipment. And finally, you see that the survey that has been conducted shows that 90% of countries have reported disruptions to essential health services since the COVID-19 pandemic. Let's look at this in the next slide more closely about the disruptions of services. So if I can have, yes, thank you, please. The survey here is a comprehensive survey on the impact of the pandemic on 25 essential health services across the life course. And it was conducted between 16 May and 6 July of 2020. The number of countries that have responded to this is 105 countries out of 185 countries. But if you take a look at the arrows, in the red arrows, you would see that the disruptions due to workforce challenges, 49% due to redeployment of clinical staff, 44% inadequate or insufficient PPE, 29% insufficient staff. This survey is, the WHO is in the process of refreshing the results of this survey. So we expect new results in March, April of this year. The bottom line in all of this is that these are not just challenges. Of course, COVID-19 has been really drastic on the health system, but the fact of the matter is that these challenges are, some of them are really due to persistent workforce challenges across the decades. Issues around, mismatch between the supply and the demand with the needs, maldistribution, misalignment between education and health, inadequate working conditions, among other challenges. And COVID-19 simply has highlighted these gaps, the gaps in availability, gaps in protection, gaps in preparedness, and that has impeded also the delivering of essential health services. Next slide, please. This is just a select of health workforce COVID-19 guidance. There has been, if you look at the website, there's plenty and plenty of guidance documents that WHO has produced. I've highlighted a couple of those that are related to workforce issues. And you can see on the first one on the right, the health workforce policy and management in the context of COVID-19, which was actually developed prepared by the Department on Health Workforce. There are others on occupational safety. The ones on the right side, for example, allows us to understand better the infection among health workers. And these really present a standardized protocol for COVID-19 surveillance among health workers that countries can use to address or to look at health worker infections. And obviously there's the guidance on the maintenance of essential services. But let me a bit zoom in on the first one on the left, which is the health workforce policy and management in the context of the COVID-19. If I can have the next slide, please. So looking at this interim guidance, as we aim to update this guidance every time we have new information, this actually look at the different types of interventions that are needed at different levels, from the individual level, the level of the health worker itself. If you look at the right side, you look at issues around remuneration, protection, occupational safety, to other interventions related to strengthening and optimizing the team approach, and then even to broader intervention at the level of the health system, from health workforce planning to investments needed, and interventions that can produce a conducive environment, such as issues around gender, leadership. So that the interventions at these different levels enable us to really strengthen the overall capabilities of the health system in relation to the workforce challenges. I invite you to take a look at this guidelines, which is on our website, and it has been disseminated and is being used by our regional offices. Next slide, please. This is a very important guidance document that is coming out, and it's about the measurement standards for monitoring the impact of the COVID-19 on health and care workers using common indicators. It is important because it's looking at the issues around infections and deaths of health workers, but it goes broader than this. It looks at issues of the health of health workers themselves, issues around stress, burnout, other mental disorders, around their social life and well-being, stigma, discrimination, and again, addresses issues around working conditions. Why is it important? Because it adopts a standardized approach for measuring the impact on health workers, and it provides comparable and measurable domains and indicators for local, national, and global use. And a very important point for us is that these guidelines, we hope, the intention is really to integrate this as part of the existing platform on national health workforce accounts, which means that countries will be able to report back on these indicators on an annual basis, along with all the other indicators that they report on. Next slide, please. Here is just highlighting a couple of articles that, excuse me, couple of articles that came out in relation to the International Year of Health and Care Workers. One in the bulletin that was written by Jim Campbell and the Minister of Health of Turkey, and the other one on the Lancet. And these, they provide sort of the full logic of the year. So if of interest, I invite you to look at these two editorials. Next slide, please. So here we go, the 5 objectives of the campaign. So the first objective is on ensuring that the world's health and care workers are prioritized for the COVID-19 vaccine in the first 100 days of 2021. This is a campaign that was launched by the Director General in January, and it called for governments and vaccine producers to deliver on a collective commitment to roll out vaccines to health workers and those at the highest risk in every country in the world and in the first 100 days of 2021. It is called the Vaccine Equity Campaign, and there is a declaration that all constituencies can support and sign, which is part of our website, and you can provide the logo. So please, get your constituencies to sign this, because it really encourages and pushes for the vaccination and the protection of health workers. It's part of the protection of health workers. Right? We shouldn't forget that the theme is protect, invest together. So that's where the protect part comes in. Commemorate and all health and care workers who have lost their lives. The second objective is really, here we're talking about people, we're talking about stories, we're talking about lives. We need to hear this. We want to hear these stories. We want people to know how many health and care workers have been affected through this pandemic. From our part, we feel that the measurement standards that we are in the process of launching and disseminating across the world is one way for us to knowing and measuring and systematically getting this information and reporting it back so that we can influence policies and decisions globally. The third objective is about mobilizing commitments from member states, international financing institutions, bilaterals, philanthropic partners to protect and invest in the health and care workers. Now, this objective is very important, and it really comes during a year where all of the discussions are around financing. All of the major forums globally talk about financing, socioeconomic recovery, building resilient health systems, and therefore it actually creates an opportunity to really push for strengthening, addressing workforce challenges, asking for additional investments in the health and care workforce, giving them decent work opportunities. If we look at some of the things that have been happening globally, one, in May 2020, last year, the Secretary General of the United Nations, along with the Prime Ministers of Canada and Jamaica, they have launched an initiative that is called Financing for Development in the Era of COVID-19 and beyond. And there were discussions on different policy options that can address the emergency situation and for better recovery. Of course, there has been a lot of consultations, and they came up with a menu of options of the things that needs to be addressed. These menu of options were discussed by ministers of finance and were also approved and considered by heads of state in September of 2020 during the UN General Assembly. So one of those things that came out is the socioeconomic response, the focus on social protection, gender, youth, health, education, and human rights, which is a whole cluster of area of work that is led by the ILO. And what it means when I say it is led by the ILO is for the ILO to really come up with concrete actions at global level, country level and regional level through consultations with through facilitating consultations that could be presented on these aspects. And therefore it creates a very important opportunity to talk about job, to talk about the youth and the expectations for the health sector and for health workers. There will be discussion during this year. A side event will be happening in April, and a lot of opportunity to influence policy messages on investment in health and care workforce. I'm not going to forget during this year, in terms of commitments and investments, there's the G7, there's the G20, and all of them, the G7 is on health security, the G20, which is the presidency of the G20 is with Italy, who also have launched a high-level independent financing financing panel to come up with recommendations by July 2021 on addressing the emergency situation. One of the important elements for us is the World Health Assembly as well this year, which starts on the 24th of May. And there we will have two items that will be discussed during the World Health Assembly. And one of them is on the future of the ILO, WHO, OECD Working for Health program, with focus on how we can increase investments and expand the existing funding to respond to this ambitious agenda. So follow this agenda. We will be talking more about it, and there will be a discussion around this in the Assembly. During the Assembly as well, there will be the launch of the WHO Academy, which will align its messages with the International Year of Health and Care Workers. Now, moving on to the objective 4 of the campaign, which is the Care Compact. And what we would like here is to have some sort of a statement, compact, declaration, whatever shape it takes, but that really outlines what needs to happen, or what commitments governments need to take in order to protect the health and care workers, and to try and influence discussions during the UN General Assembly and beyond. This is still work in progress, as this type of work requires champion governments to take it forward. And the last point is related to the last point, or the last objective, is around bringing together communities, influencers, political and social support and solidarity, advocacy and care for health and care workers. And that's really around the discussions that we're having today, also as part of the process, and other ways in which we can disseminate these messages globally and can influence local leaders and champions and policymakers, given what I have told you now in terms of all the important fora that are taking place. Next slide, please. This slide has some of the key events in 2021. I have to emphasize that it is not meant to include everything. There are a lot of international days for specific professions that are also considered. We have a broader calendar of events. Actually, the ones that I have included here are the key events that carry the political weight that can support the objectives of the campaign in terms of the Care Compact itself, that we've spoken about in terms of the investments agenda and the funding, the increased funding for this agenda. And looking across, I've covered quite a bit in the previous one, some of these issues, but just you can see the first 100 days on the 100 days for the vaccine equity campaign up to World Health Day, which is this year's theme on World Health Day is building a fairer, healthier world. And you've seen that the press conferences, there was engagement of health workers during the press conferences during this period. The one important events is the Generation Equality Forum that was launched in Mexico in March. And most recently, I don't know if you've heard about the initiative that was launched by WHO France and the Women in Global Health, which is the Gender Equal Health and Care Workforce. This initiative really is about bringing visibility, advocacy, and dialogue, and also technical information on women in the health and care workforce. And the commitment, the kickoff meeting was last week, but we expect during the Generation Equality Forum in Paris that governments will be making commitments towards gender equity in the health and care workforce. In April, you've seen the Financing for Development Forum, and there will be side events, possibly for the ILO as well, in relation to the work that they're taking forward in terms of the Financing for Development initiative that I spoke about. There's the High-Level Political Forum in July, and again, this political forum is really a platform for the United Nations to follow up and review the 2030 Agenda for Sustainable Development and the 17 Sustainable Goals. This year, the theme will be Sustainable and Resilient Recovery from the COVID-19 pandemic. And of course, the G7 in July or June, I'm checking the dates as I'm looking, it is in June, 11 to 13 June, and the G20 that will happen in October. Of course, the UNGA coming up, and we hope to be able to influence the discussions there through the Care Compact that we've spoken about. Now, in November, we will be having the 5th Global Forum and on human resources for health. Definitely this needs another discussion by itself, because that's a whole presentation, but obviously the Youth Hub is a very important part of our forums, since it fourth global forum. You had your space, and you have your space this time as well for the fifth global forum. And of course, we end with the UHC Day, and hopefully looking at a possibility of having some of the work that we're doing integrated in resolutions that will be coming out of the UNGA as well. Next slide, please. How to engage communication. So I would like to invite you, you've probably already have seen our website. There are plenty of posters, materials that can be used, and it provides many ideas. If you look at the get involved part on the right side, many ideas on how to get involved, and materials available for you to use. And on this side, please don't forget the call to action on the vaccine equity and the possibility to sign the declarations. And next slide, please. Engagement, of course, social media. You have the hashtags here. Data, these are just ideas for our discussion today and additional ideas that might come, but just to start the discussion: data, facts, key messages, engaging with local leaders and champions, any technical documents that could be produced to provide the facts, figures, and to influence policy, to give messages and influence policy discussions. This is extremely important, given all of the important fora that are happening this year. Therefore, whatever is produced, and whoever you want to influence, you need to be thinking about the timing of when you have these documents ready. Stories, best practices, any other events, opportunities, advocacy, all ideas, all on the table for discussion, and additional ideas welcome. And next slide is one of my favorites. That's the final slide, but it's a big thank you for all of you as well. For being there during the pandemic, supporting, and thank you.
Thank you so much, Rania, for this wonderful presentation, and for the kind of the comprehensive overview of a lot of well, milestones, but also important dates to keep in mind as well. And also ideas about how we could potentially engage with this very high level political discussion that sometimes as youth, we forget that this is what's going to shape both our future, our jobs, etc. So certainly a call to the colleagues who are on the call today to not really forget, think, oh, well, this is very far from what I do day to day, either in my organization or at my job. It is time for us to engage, because this is when we talk about financing at the global level, we're thinking that that has nothing to do with me, but this is in reality has everything to do with our future and near future over the coming few years. I am just going to go back briefly to the previous slide about the ideas, and just to keep that, for you to keep that in mind, to maybe stew on it a little bit while we hear the next presentation, so that we can get back to the discussion. So those are the proposed ideas on how to engage. So just take a look, think about it, see what you could add, and also see specifically how can we make some of those suggestions more concrete so that we can take them forward in the Youth Hub. All right. So here I'm gonna briefly stop sharing. You're gonna have some time to think about these, but also we're going to hear next, as promised, from Po-Chin, IFMSA president and final year medical student in Taiwan. And from his perspective, what does it really mean for him, for young people, that the year has been designated as the year of the health and care worker, and maybe some reflections about his experience at the front line. Po-Chin, I am going to give you permissions to share your screen if you'd like to, whenever you're ready.
Okay. Thank you, Kalim, for the introduction, and Rania for the very awesome overview to the whole idea. It's my honor to here represent IFMSA and share some of my perspective and also IFMSA's perspective based on the policy document we have and also the collective experiences we collect from our members at the front line. So I think we all agree that in the past 1 year where the pandemic of COVID-19 has been with us, we experienced from the lack of personal protection equipment, shortage of frontline personnel, and then mental health and burnout issues all over the world, loss of our friends, colleagues, and teachers, and also sometimes there are the discrimination against the healthcare workers. I think it's also undeniable that COVID-19 itself is not the culprit to these problems. It is just indicated to us the existence of these issues. So to further dating on that, it should be certain that our healthcare system for now is vulnerable, and to strengthen it or to better equip with it, it requires a sustainable investment or sustained investment and support from the government and the private sectors. This investment to me should go beyond like financial ones or like overall the planning from the government or at the local levels. I would also want to put some emphasis on the investment to the healthcare industry itself, including education, research, and capacity building to health and care workers. And I also believe that this should be put at global and national political agenda because they have different level of impacts to the direct the policies for healthcare workers. And also, it has been a heated debate either in medical school and hospitals that adequate rearrangement on the national policy for training programs for medical student recruitment or doctor recruitment is needed because when there is sometimes shortage of personnel, all governments might want to increase the numbers of students number that go to medical school every year, not just medical students, but nursery students, all the interdisciplinary politics of it. So that's somehow arise the issues, how to balance the quality education, quality services, and also the amount that we need at the same time. But the thing seems to getting better with the introduction of various vaccines, and we are starting to think about that the new normal is coming actually very soon. As Ronnie has introduced to us, the priority for the COVID-19 vaccines in the first 100 days of this year for health and care workers is one of the 5 objectives of the campaign. But we also want to point out that now we are almost in the 60th or 70th day of this year, but still many countries and regions in this world still is not accessible to vaccines yet. So that should be kept in mind for us. Also, it is undeniable that the vaccine hesitancy do exist even among the healthcare workers, and that could somehow hinder the vaccine protection at the front line. The reason behind that could be 2 parts. One is that it is a rapid progress and rapid development and the ratification of the vaccine itself. So the need of more supporting scientific evidence is needed. Also, from many countries, when there are forced or the healthcare workers are asked that they must take the vaccine itself is already against the human anatomy and a freedom for them to choose what type or which brand of vaccine that they want to get. We want to also point out that the freedom or the autonomy for health workers to choose whether or not they want to get vaccinated or what vaccine they want should be noted and should also be respected. Last but not least, as a medical student, and I know many participants here are already junior doctors, so I would just also want to point out that although healthcare students or even the junior members of the clinical physicians, clinical workers, they do need to be protected, but they also need more approach or exposure to the frontline service, so they can also learn from this pandemic and get experiences from this pandemic. Looking back in the history we have, there are many different episodes of pandemic or epidemics in the history. And healthcare workers at different years and different time, they manage to contend them with the ability they have, the knowledge they have, and the experiences they accumulated from their predecessors and from their teachers. This handover of the experiences and knowledge among generation is a key factor to future success as well. So I would like to, on behalf of FMSA, call for the empowerment of junior healthcare workers and, if possible, students, and the engagement of them in various processes, including decision-making or the policy design when the emergency comes up. The theme of the year, Protect, Invest Together, exhibits the ambition of WHO, which is very clear. With their leadership, we believe that the joint force of healthcare workers and also non-healthcare workers, but the interested individuals around the globe should help us to ensure that this issue is always under the spotlight and will be chronically improved stably. But in the past 1 year, many governments, many countries and private sectors and individuals, they noticed that the importance of supporting health and care workers. I personally just hope that this engagement and this priority or this need identified will remain even in the post-pandemic era, because post-pandemic itself can also be pre-pandemic until the next emergency arises. So with the concept we have and the discussion we will have, how the healthcare workers can also play a role in promoting these ideas, and we should be able to get ready as soon as possible from now on. So that's the opinion from myself and also some of my FMSA colleagues. I look forward to the discussions we will have and look forward to also what Rodnia and perhaps Jim will be introducing to us furthermore on the concept we might have. Thank you.
Thank you very much, Pochin, for all your thoughts. You certainly leave us with a lot to reflect on from the youth perspective, and this is certainly a very important and very timely when we are talking about how do we engage with the global agenda and what is it that we as young people would like to see done. So as promised, we're going to continue our webinar with a discussion. And I would tell you that WHO is taking this very seriously. They have asked us to make some notes about all of your ideas to see how we can get those incorporated in the planning of the upcoming year. So I will certainly be making notes about your suggestions, your thoughts, etc. Then hopefully you will be able also to see where those have ended up in the planning of the year. You'll certainly also hear more from the Youth Hub side, but as of now, I'd like to open the floor for contributions, ideas, etc. I'd like you to kindly raise your hand in the using the Zoom function, and I will be calling you in the order as that I see hands coming up with. And then when I call your name, please kindly unmute yourself. Feel free to share your thoughts as well as any suggestions you may have on how to engage and how to uplift that campaign of the year of the health and care worker even more, because not only we want to have ideas on how we can contribute and what we would like to see done, but how can we make sure that for the sake of young health workers, but all health workers as well, we can get this campaign as far as possible. So we're going to start by Saad.
Yes, hello everyone. Thank you, Colleen, for giving me the floor, and thank you to the esteemed presenters, speakers for the highly insightful information. So I'm a final year medical student from Morocco and a previous IFMSA member, and I want to shed some light on a very important component or stakeholder to really bring and include in the table, which is patients and the general population. When we speak about healthcare workers protection, we're speaking about also the mental hustle that and the negative view sometimes that we as health workers can have from the population, being considered as inhuman, being considered as money-sucking machines sometimes, especially in low middle income countries where I come from, for example. So forgetting that we are their families, we are part of the society. So talking to the community, talking to the general population and telling them that, okay, these are healthcare workers, these are the problems that they are facing, they are humans such as yourself. So please play a role as a community to help those healthcare workers. And I'm sure that the community can contribute in many ways. So as healthcare workers, we're not really the best people at promoting ourselves. We tend to be humble, but I believe we need to speak about ourselves when it comes to community promotion and engagement. So that's a reflection to share from my side.
Thank you very much, Saad. And indeed, this is a very, very important point that oftentimes we forget when we talk to each other about the importance of health workers. At the beginning of the pandemic, I think many remember that in many parts of the world, people were going out and applauding healthcare workers on a weekly basis. And now suddenly in many parts of the world, we are again being seen a little bit like what Saad mentioned as the bad people. So certainly a very crucial group to include. Thank you for that. Any other thoughts, any other ideas? They can be as specific or as broad as you would like. Of course, the specific ones are easier for us to translate into concrete actions, but even if you give us a another big high level thought, we can also add to it potentially. So anyone else?
Let me ask you a question though, if I may.
Yes,
I mean, one of the things would be if you are looking to having a care compact that can influence policymakers. We've heard some of the things that our colleague just presented now. What sort of elements would you like to have covered in the care compact? And how can you integrate, what kind of process can be put in place, for example, Colleen, to get this information so that we can build it within the statement, but coming from the perspective of youth health profession students?
Yes, thank you very much, Rania, for a really great question. And I think many of you over here on the call are very familiar with declarations, etc. And your organizations have produced several also sometimes all together. So if you want to contribute verbally, please raise your hand. Also, please feel free to use the chat. We will also record those discussions as well. So I will go with Ahmed next.
Hello, can you hear me clearly?
Yes.
Okay, great. So my name is Ahmed. I'm a medical intern. Like I finished my internship already, so you can consider me a medical doctor already. So I come from Egypt as well. My question is basically about the engagement of us as members of the Youth Hub. I have checked the timeline throughout the presentation, which I'm really grateful for. And my question is about our engagement. How do you suggest us to be engaged? How can we be engaged in this? What particular role, if any, could we possibly play? Thanks.
Thank you, Ahmed. I think that's a very important question that we have been discussing with the WHO leadership for some time, but I think maybe Rania, Ayat have some thoughts on specifics or even more kind of general points.
Absolutely. I'll start, and if Ayat would like to add as well, would be fantastic. First of all, the Youth Hub is one of the members of the steering committee for the International Year of Health and Care Workers. So you have a seat to be sitting with the Director General and presenting your views and ideas on certain things that you would like to, your ideas, the things that you would like to influence, the additional work that you would like the support of the organization with. So that's an important point. So our colleague for the presentation said that you would like to have a seat in where the decisions are being made. And that is one important venue. But additionally, I see the Youth Hub, and I would let probably Ayat talk a bit more about this, is that you have the place to be creating documents that reflect the situation and reflect views, reflect facts, bring evidence from the field on what is happening and your views on how things, in which direction these things need to be going. Now, the fact that you have a Youth Hub that is attached to the Global Health Workforce Network and WHO, it means it opens a venue for you to be able to influence some of the key messages during this year. Messages going to the big fora, for example, such as the work that's being done through the UN Secretary General's discussions on youth, on employment, messages through the World Health Assembly where decisions are being made on different policy options that can influence the situation of the youth and youth health workers, messages through the Care Compact, as we have discussed earlier, the UNGA, and also during the 5th Global Forum. So you have a connection point that can help channel some of these discussions. What you need to do is make sure that you have the rationale, the evidence, the ideas, and the asks. To be able to get it through the right channels. I don't know if Ayat, would you like to add something to this?
Thank you, Rania. Thank you, Colleen, Fuchen, and colleagues for this event and for the lively discussion. And indeed, Ahmed, as Rania mentioned, the mere existence of the GHWN Youth Hub itself is a platform we are encouraging throughout the year, not only because this is the year of the health and care worker, but in general, we are encouraging specifically the sharing of your ideas, which will be coordinated and better collaborated through the GHWN Youth Hub. So the messaging that Rania was mentioning, we're also organizing through the GHWN Youth Hub. Other than the online conference itself, a platform, a quarterly platform where we bring youth and policymakers together, blog series, sharing of real life stories, and better positioning the voice of youth throughout the organization, the WHO, and within our other partner, UN and other organizations, and building wider networks with youth in general. So we are at your disposal, and we are looking forward to these concrete messages, to the blogs, to the policy briefs that we are also preparing for throughout the year. So it's with your voices, it's with your contribution, and with the evidence that will be generated that we can highlight and better share and advocate for this. I hope that answers. Over to you, Colleen.
Thank you so much, Ayat and Rania, for also the confidence you put in us in the Youth Hub. But I certainly echo that the Youth Hub has opportunities and also has a wide membership that we are hoping to engage. Some of you who have been members of the Youth Hub for some time know that we work through different working groups that have been working very, very hard in order to deliver products, events, etc. This may not be always evident to the newly joined members, but certainly we also encourage you to share any ideas you have with us either for high-level engagement with the WHO, the UN system, etc., but also for things that you'd like to see done in the hub. I do want to mention one upcoming opportunity, which is the online conference that is going to happen in April of this month. This is going to be a very exciting opportunity to learn, to share thoughts, ideas, experiences, but also to come up with action plans for the rest of the year on the health and care worker agenda as well. I know that there are some members of the organizing committee here, as well as our lead for the conference, Ave. So please expect very high-level speakers, also very exciting opportunities and discussions. So you'll hear more about that coming up pretty soon for registration, and I hope that you all can make it. I would say that since our time is almost ending together, we have 1 more minute to go. For some future steps for us, I took down some of the ideas that you had. Certainly more than welcome to either send the Youth Hub, your ideas to the Youth Hub email. More than happy to receive them in my personal email, but the Youth Hub email is where we would keep all of those and hopefully take them to the WHO Health Workforce Department for some further planning throughout the year. We will be launching a working group for nursing, so student and young nurses and midwives, to tap into their experiences whenever we are discussing nursing issues in the hub. So please expect to hear from us this upcoming week. And I hope that many young nurses and midwives will join us for that exciting working group. We have a lot more that will be coming out as well. But as always, you are more than welcome to share your ideas and your thoughts with us. And I'm hoping that all of us can contribute to some specific ideas for the Care Compact that Rania asked us about, and we will develop a mechanism to get your ideas in the near future as well. So at the end of this webinar, I would like to thank our speakers. Thank you very much, Rania. Thank you, Pochin. Thank you, Ayat, as well. And I hope that we can all continue being engaged for several months and beyond on the health workforce agenda. Thank you, everybody.
Thank you very much.
Thank you.
Bye.
Bye.